It's a Northwest Lifestyle Weekend on Como News. IRG's Health Talk continues.
All right, our first guest today is a medical director at Overlake Medical Clinic's Urgent Care Facility, Dr. Eunjun Yu, who is going to talk to us today about millennial health care. So this is about for the younger generation coming up and how they need to be aware of what their health issues might be.
Yeah, to you and me, Tom, they're the younger generation. You're a baby boomer, remember? And these are the kids that grew up with technology. I mean, they're very sophisticated. They're very internet-based. You know, they do everything online. So the changing healthcare, how to schedule an appointment, et cetera, et cetera.
All right, here is Dr. Eunjun Yu and Shannon O'Kelly.
Dr. Yu, thank you for joining us and welcome to Health Talk. How are you today?
I'm very good. Thank you for having me.
I always enjoy talking to physicians. You work at Overlake Urgent Care Facility. Tell us about your practice.
Well, we are an urgent care clinic. We currently have 4 locations, soon to be a 5th location in Sammamish. And we are a walk-in clinic. 2 of our sites open from 7 a.m. to 11 p.m. And then we have 2 Bellevue locations in downtown and Lake Hills neighborhood that is open from noon to 10 p.m.
Wow, great hours for busy people. You're a family physician. How'd you get interested in urgent care? What was your draw to that area of practice?
Well, I started out in primary care for about 9 to 10 years, actually, and I got really attracted to the variability of urgent care, the broad spectrum of what we see, the satisfaction of being able to answer questions and give treatments in an immediate setting is very satisfying as a provider. To be able to treat people so quickly and give them a very quick treatment for whatever they come in for.
Well, that's excellent. Let's back up a little bit. You mentioned kind of interesting in today's world, healthcare providers have really recognized the need for convenience and how busy we are. Just everybody. I mean, everybody is so busy. And you just described some late evening hours. We too at IRG Physical Therapy, we decided to go evening hours, and we're open till 8 o'clock at night, and we can fill those 8 o'clock appointments because people want that evening time. Let's talk about millennials. Let's talk about this new generation. I just read something the other day. If you were born after 1985, you have basically, as far as numbers go, taken over the greatest generation population. So these millennials we talk about are a huge generation, a lot of numbers, and they want what in healthcare?
They want easy access, they want quick health care, and they don't want to wait for appointments.
You know, they don't want to wait for appointments, and they want quick access, and they want to control it through maybe scheduling their appointments or getting online. They're very internet-based.
Absolutely.
They're very virtually based. They're very technologically sound people. I mean, they grew up with Xbox, PSAs, or whatever they were. I don't even understand that. But is that the whole urgent care model? Because not just Overlake, but we see a lot of urgent care facilities coming up, and it's all about convenience.
It is to a degree. I mean, urgent care shouldn't replace your primary care provider, and it also does not replace the emergency room. You should probably think of it more as a bridge between your primary care provider and the ER. We're a great way to help you establish with a primary care provider if you need one. We're great for the acute, immediate issues like sinus infections, urinary tract infections, ear pains, colds, flus, that kind of thing.
And one of the things that might be interesting with millennials is they're very active, and I mean I know they participate in a lot of sports, and a lot of these sports are after work and in the evenings.
Simple fractures,
exactly.
Yeah, we get a lot of those, especially in the summertime. Everyone's so active up until 8 or 9 p.m. because it's still light out, and so we'll get those ankle injuries and I fell on my wrist type injuries while hiking, and they'll come in at 8, 9, 10 p.m. Urgent care provides a great place for you to come for those simple injuries rather than going to the ER at that time of night and waiting 5 or 6 hours in the ER. Most urgent cares will get you in within an hour.
Yeah, and I know the millennials are very internet savvy, and there's a lot of research, and we have so much information coming at us. I don't know if you found this. Patients come in way more educated, or they've been on the internet, they've investigated their diagnosis, et cetera, so they're coming in with a lot better questions, I think.
Absolutely. I mean, the internet really has changed medicine in the last 10, 20 years. About 30-40% of people who come in have already done quite a bit of research. Actually, I think it's more than that on the internet. And they come in with an idea of what they have already.
We're talking about millennial health care with the medical director at Overlake Medical Clinic's urgent care facility, Dr. Eunjun Yu. Our conversation with Dr. Yu and Shannon O'Kelly continues after this on KOMO.
It's a Northwest Lifestyle Weekend on KOMO News. Here's Tom Hutler and Shannon O'Kelly with more IRG Health Talk.
Let's get back to our conversation with Dr. Eunjun Yu and Shannon O'Kelly talking about millennial health care.
Dr. Yu, thank you again for joining us. We're talking about urgent care. You're a primary care physician that's migrated to the urgent care environment. You enjoy it because you get immediate results. You get to educate your patients. And we're talking about millennials and health care. And we were just talking about how sophisticated or how much information patients have because of the internet when they come in. That's good. And sometimes bad, because I know sometimes you can Google those symptoms and you can get a lot of diagnoses that sometimes it kind of work you up.
Right, exactly. No, overall, getting information and being transparent with information is a wonderful thing. And for most people, it gives you a lot of tools to go into your provider and come in with a lot of background information and a lot of questions, which is great to begin a conversation with. The danger of that, of course, is misdiagnosis.
Right.
And a lot of the time, I'm spending quite a bit of time trying to discuss with patients why they don't have a certain condition.
Yeah, good point.
Why that headache really is only a sinus infection and not a brain tumor.
Exactly. Yeah, you can Google headaches and the symptoms come up. Next thing you know, you're paranoid. So I mean, it's good and it's bad. One of the good things I think in medicine is the ability to use technology to share information.
Absolutely.
And medicine's kind of progressing down this road that's going to be very virtual. I mean, at IRG, like we're sending electronically home programs. We have video exercises. We're using text messages to contact patients, schedule patients. So we're using technology a lot. Millennials love that.
Absolutely. And Overlake provides that service as well. We have our electronic medical record system has a network called OneChart and MyChart, which gives patients access to their own record online, allows them to make appointments with the regular primary care providers and specialists online or request those appointments, see all their test results online. We also have our wait times in the urgent care posted online. I mean, the internet really has allowed us a greater level of transparency and efficiency.
Do you find the millennial population, are they attached to primary care doc, or are they just looking for convenience? And, because, when I grew up, you had a family physician, right? And you just kind of went to that family physician. What's the situation now?
Less and less millennials do have primary care providers. About 30% of people who utilize the urgent cares on a regular basis do not have a primary care provider, which for most young, healthy people without chronic medical problems, that works okay. But as soon as you develop any kind of chronic medical problem, you really do need that primary care provider. And I can not stress enough that preventative care is so much better than being diagnosed after the fact, in terms of overall health cost and the emotional cost to you in terms of failing to diagnose a condition early.
Absolutely. Prevention wellness, it's the wave of the future in healthcare. Dr. Yu, thank you for your time, great information, and good luck in urgent care.
Thank you very much. Thanks for having me.
That's Dr. Eunjun Yu with Shannon O'Kelly. Dr. Yu is the medical director at Overlake Medical Clinic's Urgent Healthcare. Millennial healthcare was what we were talking about, Shannon. And, in this day and age, technology sure plays a big part of that.
Yeah, Tom. I mean, these folks are coming into your clinics and they have already researched their diagnosis or the injury. They know a lot.
And it's getting to be more and more where you can try and sometimes diagnose by sending in a photo of maybe an injury you have. So it's becoming more and more the norm to use technology to your advantage.